Great. Good morning, everyone, and welcome to Thursday. And those of you who still enthusiastically here, we appreciate your energy and persistence, and it's wonderful to have everybody in the room today. I'm Linda Gale Becker, President of the International AIDS Society, International Chair for AIDS 2018. This press conference is being live streamed on AIDS 2018 website. There will also be an archived recording available later in case someone can't make it. But to those of you watching this morning, welcome, nice to have you. This official press conference is going to focus on sex workers and so-called in-demand policies, and more broadly, the topic of decriminalization. Of course, this is a topic that has attracted increasing attention, and rightly so. The impact of laws are intended to end demand for sex work. But as I think you'll hear from the panelists here, these end demand laws, where they have been adopted or are being adopted and are being considered in a number of countries, and typically under these laws, sex workers themselves commit no crime, but their clients and third parties are criminalized. Supporters of end-demand laws have argued that this approach will increase sex workers' access to essential services, including HIV prevention and care. We're going to hear from two authors today that I think bring some truth and evidence to that hypothesis or statement, and I'm looking forward to hearing from them. So as of this moment, the embargo on those two studies are now lifted. So it's my great pleasure to move to our first speaker, Eleanor Argento of the University of British Columbia. Eleanor will share an analysis of a Canadian in-demand policy and its impact on sex workers' ability to access HIV care. Over to you.
Thank you. So following a global wave of end-demand criminalization of sex work, which focuses and targets clients and third parties while leaving the sale of sex legal, and in the absence of any science to support this model, new end-demand legislation was implemented in Canada in late 2014, known as the Protection of Communities and Exploited Persons Act, or the PCEPA. This approach is also known as the Nordic model, based on legislation in Norway, Sweden, and other European countries, that aims to eradicate sex work by ending the demand for sexual services and conflates sex work with trafficking. The PCEPA also includes funding for sex workers only who are exiting the trade, mirroring PEPFAR's anti-prostitution pledge. This is a major concern because this approach has been shown to limit resources to support community empowerment, which is critical to preventing violence and HIV. Given there is limited evidence on the effectiveness of end-demand models, we conducted a longitudinal study to evaluate how the PCEPA impacted sex workers' access to health and sex worker-led support services pre- versus post-law reform. We drew on data over 8 years from a community-based cohort of 900 cis or trans women sex workers working in street, indoor, and in the online industry across Metro Vancouver, Canada, known as Aisha. We found that after the end-demand laws were implemented, sex workers had significantly reduced access to health services and sex worker-led supports. Specifically, sex workers had 23% reduced access to sex worker-led support services, and these could include outreach, drop-in centers, and peer support after the PCEPA was implemented. Sex workers also had a 41% reduced access to health services when needed after the new laws. And there were no changes in access to HIV treatment and care for sex workers living with HIV. So our findings demonstrate that end-demand models continue to replicate and exacerbate harms to sex workers and barriers to accessing health, HIV, and community empowerment services. Our study is the first in Canada and among the first globally, alongside critical evidence from France, to examine the impact of end-demand laws on sex workers' access to health and community services. Also, alongside a new call to action in The Lancet, an endorsement by numerous human rights and policy bodies such as UNAIDS, WHO, and Amnesty International, This research demonstrates the critical need to repeal end-demand criminalization and ensure political and funding investment in full decriminalization of sex work to facilitate community empowerment and ensure health and human rights of sex workers.
Great. Thank you very much, Elena. And I will just thank you for noting that I think it's also important we hold ourselves accountable. And in 2014, we launched the series on sex work and HIV at the Melbourne conference. And I'm very pleased to say that at this conference, we have the 2-year update of that to really say how have we done in meeting the call to action that was actually put out there in 2014 and maybe it was 2016, and now where we are in 2018. And, you know, I can only say it's dismaying how little we've been able to achieve. So I do think whilst we're worrying about accelerating, and rightly so, our targets to meet the targets for 2020 and 2030, it's time we put some real targets in place and goals and really map how we're doing in getting to the goals we need to be able to make sure that sex workers are able to meet their own health goals. But at this point, I'm going to hand over to Hélène Lebau of the CNRS. She comes to us from Paris, and she will share an analysis of France's laws aimed at ending demand for sex work. So over to you, Hélène.
Yeah, so thanks a lot. So in the case of France, the criminalization of demand, so the criminalization of the client started 2 years ago, and with a collective of 11 organizations, among which there are some community-based NGOs and sex workers groups, we decided to launch a research during the 2 first years to try to evaluate the impact on the health, on the well-being, and on the rights of the sex workers. So the first results after 2 years of research are available on the web if you want to see, because it's very difficult in 2 minutes to summarize all the results. But I'm going to try to highlight 3 points. I hope I have time there. And these 3 points may help to deconstruct wrong images we can have about the Nordic model. So the first point is just to say that after 2 years of criminalization of clients, the reality is that sex workers are still more criminalized than their clients. Because of local measures, you can still, it's still the sex workers that are more often arrested, more often controlled by the police, and pay more fines than the clients today. So even if we have introduced the Nordic model in France, and even if the objective of such a law is supposed to be to protect the sex workers. So the second point is that it doesn't matter if you criminalize the sex workers' practices or if you criminalize the clients, the stigma is still there. It doesn't change anything in terms of stigma. On the opposite, the survey shows very well that in the case of France, during these 2 years, stigmatization has increased. Like it is in Canada, the law also introduced what they call an exit program, so a program to support people that want to stop, that should stop, according to the law, should stop sex work. And there's a real fear from the point of view of sex worker, a real fear that such an exit program would further stigmatize the one that don't want to stop sex work or the one that cannot stop sex work. And the last point, if I may, is that all the impact of that law, and the impact is very strong even after 2 years. It's very visible in France. It's even worse than we thought it would be before. So in terms of the fact that it's violence is increasing, working conditions are more dangerous, autonomy is decreasing for the sex worker, and all these elements are often described by the policymakers or by the prohibitionist activists as collateral damages. And the question from that the sex workers have raised in the survey is, is it morally acceptable to consider this impact as just collateral damages? So this is just the 3 points I wanted to highlight.
Thank you, Hélène. Appreciate that. And moving now to a fellow countrywoman. Our next speaker is Duduzile Dlamini of Sweat. And Dudu will share the perspective of sex workers and other key populations on end demand policies. Over to you.
Thank you. We are in demand of policies because of criminalization. It's not a model that it's working for us, especially in South Africa. In South Africa, for now, we are criminalized since 1962. That is offense of that criminalized sex workers both and the client in 2002. And we don't want any model. We're looking forward to get full decriminalization of sex work in South Africa, because the only model that it's cover sex workers, that they will be feel free and feel their dignity and feel like real human beings, because criminalization affects sex workers as a whole and in whole world, whereby they're not able to exercise fully their human rights, they're not able to report cases, and the violence towards sex workers are too high. Instead, special for South Africa, they're not even able to report cases to police station, because the relationship between sex workers and the police are not good. By saying that we want full decriminalization of sex work in South Africa, so that we can able to exercise full rights as a human being in the country of the good constitution and laws. We want to remove those laws who label sex workers as criminals. We want to remove those all these laws that make us and our children and our families like criminals. For now and from today and go on, we demand justice, we demand our rights, we demand our dignity. We want everyone to recognize sex workers as human beings, as women, and we want to exercise fully rights as human beings for now and go on, so that we can able with our children to respond in HIV fully and reach the target. We need to include sex workers, we need to include our children, we need to include our families in this for changing the laws and remove the laws who label sex workers. We want full decriminalization of sex workers. Other models, we don't looking forward to it.
Thank you, Dudu, and I think that was an impassioned cry. So I just want to, in contrast, share that on Saturday I had the wonderful privilege of going downtown and spending some time with community in the red light district, and particularly with a project called My Red Light District. And I was absolutely, my mind was blown, just in contrast to some of the things you're hearing here, in contrast, an organization where one feels that people are having choice, they are existing with dignity, they're actually getting on with their lives and their work. And some of it's good and some of it's bad, like all of us who have to go to work every day, but really they are getting on with their job, and the services that are, specifically available, that people are getting to those services, and that really is the unbelievable contrast to some of the descriptions you're hearing. So I'm going to put up that advertisement that if you have time and you can, go down there and just see, perhaps a model for how things could be done differently around the world, and I strongly recommend that. Right, I'm going to move on now to Loveness Bawagunda from Malawi. Loveness is a drop-in center manager for YONECO, or Youth Net and Counseling. I'm pleased to say, and congratulations, Loveness, she was nominated for Me and My Healthcare Provider Award by a sex worker client who praised Loveness for her openness and compassion as a healthcare provider. And so congratulations, and we'd love to hear your thoughts.
Sex working in Malawi, I'll talk on perspective of Malawi, my country. Sex working in Malawi is not allowed. But the prevalence rate for sex workers is at 62%. the prevalence rate of HIV for sex workers, it's at 62%, which is much higher than that of the general population, which is around 10%. But the government, everyone is still neglecting that. I'll just give some of the examples of stigma and discrimination that is happening in Malawi. Most of sex workers, they are not attended well when they go to the health facilities to assess health care services like prevention, HIV prevention and treatment. Every time they go to the health facility, they are neglected because they are sex workers. And when they go to report to the police, they are not assisted accordingly. They are just because they are sex workers. It's only because of the organization that I'm working with, YouthNet and Counseling, that fights for the minorities in the country. So if it wasn't for that, sex workers, they are very discriminated and stigmatized. There's this example, one sex worker went to the health facility to assess ARVs, and the health care provider said, I cannot assist you because you contracted the virus deliberately. And she defaulted from taking ARVs, and the viral load was very high. The moment she came to our drop-in center, we tested her, the viral load, it was very high. Then we started with the organization I'm working with, Yonego. We started sensitization of the health care providers in different health facilities. And at least some of them, they understood and take it and started providing health care services where to the sex workers. And there was another one who was beaten up by the client, and the moment she reported the case to the police said, you are a sex worker, you deserve it. So sex workers in Malawi, they really face stigma and discrimination a lot, especially in those districts where linkages project is not implemented. But in the districts where a linkages project is implemented, it has been reduced. Yeah.
Thank you, Loveness, and once again, thank you for being a shining example to my colleagues as healthcare providers to pull up their socks and do things differently. So thank you for that. Our next and final speaker is Cindy Cynthia Samuels of the Guyana Sex Workers Coalition. And Cindy is one of our rising youth leader stars, and she'll actually be coming to you on Friday in her plenary to share her work as a youth advocate, and the plenary is entitled Growing into HIV Leadership. So over to you, Cindy.
Hi. Firstly, I would like to say that there's a lot of work still needs to be done with the public when it comes to sensitization and knowing what is sex work and what it isn't. Sex workers are not all victims, because it's like, soon somebody hear you're a sex worker, they say, oh, you have AIDS or you have HIV, and this is a major misconception that needs to be fixed. Mm-hmm. There's a lot of presentation that I've been seeing about Guyana, which is true that between the ages of 70 to 24 are the most newly infected young adults. This is so because in Guyana, the age of consent is 18 years, but you cannot access... The age of consent, is 16, but you cannot access health care until you're like 18 years. So by the time a young adult finishes school at 17, they're already sexually active and might not know their status because they cannot access health care. By the time we get them tested, because some of them, whether we turn a blind eye, they are young persons from the age of like 15 to 17 that are in sex work, but we cannot put them in our data because they are underage. So sometimes when we do test them and we find out that they're positive, we try to find ways to get them on the medication and what's not. But when they are of age to actually access healthcare, especially the ones that we are not able to meet, it's like sometimes the virus has already rapidly spread. So we have to pay special attention to them. It's like nurturing a plant from seed to seedling up. data also shows that 63% of persons infected with HIV are youths. Early engagement of young people give them the tool to allow them to be more informed when they are engaged in sexual behavior, which is something that we are fighting for right now in Ghana, that they need to start teaching appropriate HFLE and sexual reproductive health in schools.
Great. Thank you so much. So we're now at the point where we'll invite questions. And if you have any questions, please, as usual, go to the microphones, which are coming. And if you just let me know who you are and whom you are directing your question to, that'll be great. Thank you. Kerry?
Kerry Cullinan from Healthy News South Africa. My question's to Elena. You said that there was a drop of around 40% in access to services, healthcare services for sex workers. Can you explain why? What was the reason for that?
Yeah, well, there was a 41% reduced access to health services when needed, which is what we asked the sex workers. And you know, basically it's a result of having these end-demand policies that are simply reproducing the same risks and harms that we saw in the previous criminalized model. So, you know, for reasons related to stigma and discrimination and being unable to access safe and non-judgmental health services.
Yes, you may. Do you still have the mic?
Sorry, I just can't understand. So it was, in Canada, sex work was criminalized, and then you brought in the Nordic model. Is that right?
Yes, that's right.
Because then what you're saying is that access to services was 40% worse than after a portion had been decriminalized. So what you're saying is that it was better when it was completely criminalized then.
No,
is that right?
It was both models are criminalized. So it simply shifted the target to the clients. So previously it was the sex worker themselves that were being criminalized, and what our study really shows is even when you switch it to targeting the clients and third parties, you're seeing the same risks and harms, and you know, in fact we actually saw it got worse, which in a way is surprising, but that's what we found.
Yeah, Elaine.
Yeah, maybe I can just add something about the French case. We have seen the same result, and one of the reasons is that when you have you need to work in less visible places because the clients don't want to be arrested by the police. And one of the impact is that many sex workers, they move to different cities. They move a lot. They work on the internet, they book a place through Airbnb, etc. And when you move to another city, you usually don't know where to go to have health services. So this is also maybe one reason why the access to health services is decreasing.
So perhaps drives people even further underground, as it were, because now the client is demanding in it for their safety that they are more.
And I don't know about Canada, but another reason is also that working conditions are worse, they earn less money, etc. And we have observed a lot of people going to depression. And when you're depressed, you don't feel like going to the health center, etc. So that may be also another reason why.
Right. So sort of hopelessness, I guess. Any other questions? Yes. Hold on, there's a mic coming just because one in the front here first, and then just because we're recording.
Okay, thank you. Christelle Destombe, I'm coming from France. I have a question, Elena, just to make sure. You said you didn't see any change in HIV status. Is that correct?
Yes, that's correct.
Thank you.
And Hélène, you didn't mention anything regarding the HIV status?
Sorry, just to clarify, not HIV status, access to HIV care.
Yeah.
Yes, sorry.
It's a little bit too early in France, and the approach we had is a qualitative approach, research methodology. So I think in France it's still a little bit too early to say anything about infections or etc. But still, what we can say is that access to treatment for HIV-positive people is getting, again, more difficult when you move from one city to the other one. That's the only point we can underline.
Great. I think there was a question towards the back. Here we go.
Yes, my question's for Dr. Argento. Andre Picard from the Globe and Mail in Canada. I'd like you to talk about what's the alternative to end demand. Is it the New Zealand model?
Yeah, thank you for that question. Yes, definitely a better model is to look at other jurisdictions that have decriminalized sex work, such as New Zealand and parts of Australia. And they have actually seen better health outcomes in these decriminalized models. So we really should be looking to these other countries and jurisdictions that have a decriminalized model and are actually showing the evidence that this is a safer and better model for sex workers.
So, sorry, did you want to say something more? Does Dudu want to say? Yeah, Dudu, other models? Do you want to add anything?
As SWET and Sisonke, SWET is a Sex Workers Education and Advocacy Task Force, and Sisonke Movement of Sex Workers and Mothers for the Future, with the projects we're working direct with mothers and their children. We're advocating fully decriminalization of sex work in South Africa. For now, in South Africa, we really criminalize, and sex workers are experiencing a lot of violence. They get killed. They're experiencing stigma and discrimination towards when they go into clinic and access health services, and they also not able to work with police. They're using condom as evidence to identify if they are sex workers. We've been done a lot of lobbying in Parliament to look at that model of New Zealand, how it's look like. But my opinion as a sex worker, as Sisonke mobilizer, we want full decriminalization in South Africa because it's only model that it shows that sex workers, they will be fully exercise human rights as human beings. And the fact that they're using the long laws that they've been used in 1957, that is the act that is criminalized, and they change in South Africa, they criminalize the sex worker, and then they come back and criminalize both sex worker and the client. And that means that we're not moving forward in the country, that it's already progressive in terms of laws and policies. But only sex workers who not look at as a human beings, that law still stays and takes long to be processed. Even now, we are still waiting for the community and the public domain to participate, because social development, social justice still staying with the reports of recommending what really they recommend for South Africa. But the fact that we are still lobbying and we're not gonna get change what we want as an organization, as SWET, Sex Workers Education and Advocacy Task Force, and the sex workers, we want full decriminalization, and we want all the countries to recognize the sex workers with the respect, with the dignity. We want sex workers justice. We don't want to be out of the system, that justice can support us when it comes to experiencing gender-based violence, when we're experiencing violation, when we're experiencing everything that is stigma, discrimination against us. We are tired of people that coming with their moralities in their houses and develop policies that they build their beliefs to say that sex workers are bad people, sex workers. We choose to be. We are not victims. The fact that we are human beings and we need to exercise fully human rights in South Africa. Now, it's end of no criminalization, no stigma discrimination, no gender-based violence towards sex workers, including their children. We want full decriminalization, no other model. New Zealand have an example. We have Australia in Sydney. I've been there in New Zealand. Look at it, how the model look like. It's look like very well, and it's a win-win solution for everyone, so that the police can respect sex workers. Everyone respects sex workers. They choose. Remember, sex workers are not the victims. Sex workers are mothers. Sex workers are sisters. Sex workers are fathers of their houses. They work. There is a lot of people who benefit in this money. We pay a lot in economic because of the hotels, the taxis, the people, the schools, even the church, they take from this money. There is a lot. We want the policymakers, we want lawmakers to know that this economic that we contribute a lot to them, they must recognize us. They must know that we contribute a lot in economic in each country. Thank you.
Thank you. Thank you, Dudu. I think, are there any other questions that may have? Yeah.
Thank you. I'm Rabita. I'm with Science Speaks. This question is for Elena. So you said there was no change in access to HIV services. Did you see a change in access to other STI services?
We didn't actually look at access to other STI services. We looked at simply just access to HIV care and prevention services, and we saw no change.
Okay, well, I think, you've heard the passion. As a member of society generally, I think it's high time we joined hands. I think the evidence is before us. And aside from all the benefit that I think you've heard here, the science shows that from a public health point of view, this just is a win-win situation. And so, but I think today's message was to be careful which direction we go down, because seemingly we can do more harm, or maybe, do nothing, but even more seriously do harm by adopting policies that may not, at the end of the day, do what we need them to do. So I want to thank those who've brought evidence, those who've brought passion, those who've brought their experience, and those who've brought examples of how things can be done better to the table today, for speaking, and all of you for participating, and wish you well. Thanks. Thanks, everyone.